I'd like to hear what has been some of your personal health challenges, if any, and particularly on this spiritual path, and how have you used Raja Yoga meditation to manage it, and what has been some of your learnings from it? So, would you like to start?
Stress is everywhere, and that's true. And when I qualified as a dentist about 25 years ago, we were told that out of the profession we're in the top 3 for suicide of all professions in the UK. But we're also on another list. We're also in the top 3 for substance and alcohol abuse as well. That's 25 years ago. Today, we're still in the list, but we've dropped down a bit now. We're still in the top 5 for suicide and still in the top 5 for alcohol and substance abuse. So my profession is quite a high stress environment. And I think that's my personal challenge. I think when I was reflecting on some of the questions that may come, and that's one thing as a personal challenge to me, is to stay balanced and focused and look after my mental well-being. And I think sort of Raja Yoga meditation really helped me in that. And I think what it comes down to, we all have stress in whatever we do, whether it's life, our work, our family, it's there. And the differentiation I really made was that certain professions have different types of what I would call pressures. We all have pressure, and I think what the key is what we do with that pressure. If we don't deal with that pressure, then that's where stress comes in, and that's where all these stress-related illnesses, like in dentists, cardiovascular diseases is the highest killer compared to the normal population. I think it's 1 in 5 more so than the regular population. So I think the key for me, my personal challenge, to stay the course for my professional working career and keep that balance, was to be able to deal with this daily pressure to make sure it doesn't become stress. Raja Yoga meditation has helped me in that. And the way to help me is that in my personal situation at work, what you all may have in common, or you may have some similarities, that when, say, I work in a confined space, and that confinement is sometimes likened to a jail cell. You know, you're working in 4 walls, sometimes there's a high window or no window. We work in isolation as dentists, so that again is another thing that causes pressure build-up. Then obviously everybody has economic pressure. We also have time pressure. If you imagine, you have appointments you've got to get to. If you imagine I have 20 appointments in a day, all of them got to run on time, and that's 5 days a week. So 100 appointments a week that have to be on time and finished on time. And within that appointment, I have to deliver my healthcare. And the other thing that I find personally challenging, and I think why the profession gets challenged, is in that appointment time, we also have to manage the patient anxiety. So they come in with their pain, they're stressed. So you've got to listen to them with empathy. You can't just brush them off. To make the communication effective, you have to allow for that patient anxiety to be dealt with. So Raja Yoga meditation, when I first came across it, allowed me to connect to my inner calmness, my inner qualities that are within all of us, and then I can play those out later on. So I think I'll stop soon so that others can speak. But I think for me, it's the Raja Yoga meditation really helped me to control pressure at my workplace, stop becoming stressed, to able to lead me a balanced life, to run a business, to have a good social life with my friends and family, and to participate in things I like to do. So yeah, I think that's where I like to stop.
Thank you.
Every day is a health challenge. Every day is a mind challenge. Every day is a stress challenge. Yet today we're here to talk about well-being. And a few years ago, I was diagnosed with an illness, and I changed the word illness to wellness, because illness gives that negative feeling, that negative energy, that negative vibration. Illness is usually, we talk about it in the negative context. Yet, for me, I tried to change it over a period of time to wellness, to mindfulness. And what I mean by that was that even though there are many types of illnesses we face, yet there's an illness that we don't speak about so much, But in the last year, I'm hearing that we speak about it very much, is the illness of the mind. And what is that illness is of extra thinking, extra pressure, like Pavan Bhai said, extra stress from all around, and especially inside. And that feeling of changing illness to wellness means to go inside my well-being. And when we want pure water, we dive deep inside the well to go down. And I found that inner journey, that inner reflection was going down right inside me, into my every vein, into my every vessel, into my bones. And it was a self-discovery that even though the illness was there, let the illness not control me. My life is not about the illness. My life is about wellness. And that wellness creates my mindfulness. And that pure mineral water of pure good wishes that I shower to my inner mind filters down through the vibration in the body and changes into very sacred energy. And that energy is what is helping me be in front of all of you today. Thank you.
For me, there have been a number of spiritual crossroads, and you may well relate to some of these. And stress has been highlighted constantly in what's been shared so far, and definitely is prevalent on the planet, affecting the minds of each of us in different ways. And so for me, when I was in a place of, there was a point in my life where it was like there was so much stress going on, and I'm one of those A-types, that can be constantly on the go and seem to have unlimited energy until there's a moment where has to stop. And if you could imagine, the stress was in so many areas. I was privileged to manage a community mediation centre in London, and there were challenges for supporting people in conflict in the community. However, this may not be a surprise, there were often more challenges with the teams working within who were to mediate and support those that had conflict in the community. So I found myself on many, many levels being stretched to understand the art of conflict transformation from inside out. So that was going on. My father, who I was close to, was terminally ill, and I would rush home, because I also have a nursing background, to support my mother, to care for him. I had an adolescent son who had needs. I was a single parent. And so on many levels, it was physical, mental, emotionally, I was stretched. And I got to that point where I literally created a self-fulfilling prophecy of, stop the world. I need to get off for a moment. It was too much. And I certainly didn't want to end my life. I treasured life. I treasured everything in my life. It was I needed some space to breathe and be. And so for me, it physically manifested as a chest infection, sinusitis. However, I was sufficiently on the spiritual path to know this was time, like Alka said, to go deep, dive deep, deep into stillness and silence. For as we teach here, it's within the silence and stillness of the mind, when connecting with the divine, with Supreme Soul, that the wisdom within can start to re-emerge. And so literally, it was like a balloon. The energy that was often within this one seeped away like the air of a balloon. There was absolutely no fear, and this is so important, because it's the opposite of stress. Under stress is the fear, yes, the fear of what if, what will happen. And I was fearless in that time. I had total trust and faith that the universe that drama had created accurately, and that's another phrase we have here at the university, drama is accurate. We're all each an actor, yes? We each have our own stories, yes? And the stage, the world stage. So drama is accurate, drama is beneficial. And even though I hadn't a clue what the solution was, I trusted enough to go into this depth of silence. And that lasted, in fact, I was off from work for 3 months. 3 whole months, I had absolutely no energy. In that time, deep spiritual breakthroughs, deep spiritual awareness, more honesty with myself, where I had actually played games of ego, more honesty of where the attachment to my father, a beautiful being, and how to learn to let go so he could let go gracefully to his next journey. And so many, many levels of depth and awareness. And so the meditation and the spiritual knowledge is what guided me at that time. That I then can bring, as I resurfaced and came back, I actually changed my lifestyle. I moved into using my skills in a different way that gave more space between the notes. When we hear Anne play exquisite healing music, be aware it's the space between each note that creates the music. So am I bringing that more into my being, into my consciousness? Do I pause and take time to go within and tune in to my truth, the inner wisdom? Do I know how to connect with the unlimited ocean of peace, of purity, wisdom, and unconditional love? When I have that pathway and I nurture and sustain it, then no matter what's presenting, either the inner conflict or the wonderful challenges in situations or people in my life, I'm creating more that sacred space that Alka spoke about. Shanti.
Wonderful, thank you. It seems that all of these situations and illnesses definitely are coming with a message, and from what I'm gathering, it helps us to get to know ourselves better and to get to know that actually our capacity is much bigger than we thought previously, but only once we've really connected within. So on that note, although it is said that most illnesses come from the mind, some don't. So how can we be sure that it is either coming from our state of mind or is it not? What are some of the things that we can ask ourselves individually to check what the cause is of a particular health issue that we're going through?
It's quite difficult, and I agree with you. A lot of illnesses are psychosomatic, but there's not a list. You can look in a book or Google it. They'll say quite a lot. So I think the first thing is to make sure ourselves are centered, like Masana and Alka shared, is to be connected to our inner sacred space. Because when you're in that space, you're less likely to be affected. And most of us have probably heard of anecdotal stories of a friend or yourself who, once you change your consciousness, you felt better without medication. And a story I can share with you is my mother got diagnosed with breast cancer, and about 4 years ago now, and it was the first time somebody in our family had been diagnosed with breast cancer. It was a big thing, but again, this Raja Yoga meditation, this calmness, dealing with pressure came into play. And I was there with her when she was having her infusions for chemotherapy, and it was just that consciousness. She was taking that chemotherapy. It was a pathological disease that needed treatment, and sometimes energy alone can't help. And that was prescribed to her, and the doctor said this is what she needs to have done, and so we did it. But if we are to take that route of both allopathic and internal help, it was the consciousness. You take that medication in there. So when I was sitting with my mother, I was trying to talk to her with the meditation, And just kind of like Alka Ben was saying, not to identify with the disease itself. You know, she is her spiritual being, and that is not disease, that is well, but there's something organic inside the body that needs the treatment. So trying to get that separation between disease and your personal spiritual well-being is a key thing. And as she was having the infusions, it was just having that meditation to think that this is good for my physical body, but my mental state is my true being, and I am well in that state. So trying to create that empowerment for the self really will help. And you're right, some of these are external and, you know, airborne or waterborne or bloodborne, which we can't escape. But when you are affected by illness, and what I found for myself sometimes, when I do create that silence, that powerful silence, and work on ourselves, things do happen at a cellular level. So I think it's more kind of anecdotal, and I think when you go through it yourself personally, or you've seen somebody quite close to you or a friend, then there's truth in that. So I think that the take-home message I would say is to always protect yourself, keep your sacred space clean, and trying to separate from the self of the physical and the self of the mental, spiritual being.
I agree totally. I think I'm not coming with the words, because everything, in my experience, everything's connected, yes? So although each of us is a spiritual being, eternal, a soul, living in this temporary body, which is a sacred temple, do I really recognize that? Do I really choose to treat this body as a sacred temporary temple? That alone is a total mind shift, yes? Huge different paradigm of consciousness. And recognizing that as an eternal spiritual being, being resident in this body, and learning how to become the master of the mind, and the intellect become strong and clear, so that the power to discern, the power of courage, the power to make decisions from, as we keep saying, that sacred space of silence, then actually changes the energy field of the cells of the body. So everything in the world of matter, in this physical world, is connected, even if it doesn't look like it, that the candle is not connected to the carpet, etc., something as mundane as that. It is, because we're tuning in, we're aware of it. And so you can apply that to anything in your life, the vibrations, the thoughts that are generated from the mind. Am I alert and aware of the thoughts I'm generating? Are they coming from a pure place? Are they positive? Are they light? Are they enhancing? Or are they pulled by the body that is going through its ups and downs, that actually reflect as a mirror, on one level, what's happening within the mind and the spiritual heart of either soul? So for me, there's no separation when I look at it in a wholeness, and I believe, and that's very much part of the golden thread that we're exploring today, is coming from fragmentation, separation, disharmony, back into wholeness, into harmony, into inner balance, that then comes back out into my environment. So when I hold that powerful intention, even when going through a challenging, be it a physical or mental health imbalance, then it's a total different vision I have of self and the other. So without speaking for more than another minute, when I was nursing, especially in my early days, that natural innocence, at the age of 18, from age 5, I knew I was going to be a nurse, and it didn't waver. And I knew, although I may not have had the words to articulate at that young age, now I know it was, for me, the presence, Prescence, I haven't spelled it right, but you know what I mean, presence, ENCE, and being present in the now, which is the gift. And I knew that those two are essential for any healing, be it for attention to myself and my well-being, or holding that sacred space of being so present and being able to tune in. And spiritually, we can physically feel a pulse. Can I spiritually tune in to the pulse of the other and be present for what is going to support them with their own healing? So it's complementary.
A few years ago, someone said to me, how do we know if paracetamol is really helping? You have pain, you have a headache, you have a migraine, and you're taking a paracetamol. And you take it, and then we feel better. And the lesson behind that question was a belief. If I'm being told something, if I've been diagnosed as something, or if I'm feeling something, what is my belief behind that? And it's that belief, and step back, it became a practice. You opened the paracetamol box, you took it and you believed in it, and you strongly felt it's going to work, and that's why it worked. And I could be wrong, but I believe that any illness that you've been diagnosed with, when we have pain, is it imaginary pain? If there's a pain in my leg, in my stomach, it's there. So to some extent there is an element of truth, and sometimes it can be in the mind. But even if it's in the mind, it's still painful. So there is pain. Whether it's physically, mentally, emotionally, it's still felt. But when I believe that this is going to help me, it is going to help me. That belief, I need to strengthen my power of inner practice of believing that yes, it is going to help me. I know because when I was first diagnosed, I was not accepting that I was type 1 diabetic and I had to take insulin. And after some time, I realized what I was doing. I was afraid of the needles. And it wasn't of the insulin, but it was of having to inject 5-6 times a day. And even though I was doing everything correctly, I wasn't believing that I was having to do this. And so the insulin was going into my body, but it was not doing its work. And after a while, when I accepted, no, this is what I have to take, but let me take it lovingly, then the insulin started to do the work. And I've never shared this with anyone, so I'm sharing with all of you that for a few years I was in and out of hospital, in and out of my own mind, not understanding what was happening. But my doctor had said, I think she's afraid of needles. I said, no, I'm not afraid of anything. But I was afraid of the needles. And it was a very humbling lesson that as soon as I said, okay, I'm going to put this needle in with love, then the insulin started to do its work. And then a bit of love was going into the body. It's a partnership between your illness and your mental well-being. That user-friendliness is what I learned, that I need to form a partnership between my body and my mind and my heart. And that is what's going to create well-being.
Thank you. So yeah, it's becoming clear to me that yes, we need to do all of the physical things, but again and again we need to check how we're actually feeling. And the more, I guess, we are in touch with our feelings, the less we will suppress them, and the less sick we will be. And if we are dealing with a sickness, then I guess it's a message to, as Alka said, it's time for more love. It's time for more self-compassion. So maybe back to basics. What do you all personally do on a weekly basis to make sure that you do stay healthy, that that you have a balance, that there is a sense of well-being? What do you do in a day? How does your day look?
For self, at this time, I ensure that for me the foundation is essential, is meditation. So for me, it's that very early morning nectar when it's peaceful and quiet. So 4 o'clock in the morning is my choice. And then again to come here right in this room to gather with other yogis and meditate together and receive more spiritual knowledge from the highest that I can apply, experiment during the day. And again in the evening to meditate and check, how did I manage during the day? What am I choosing to maybe adjust? So that's essential. And take in the pure spiritual powers directly from the Divine Supreme Soul. And during the day, check and change. When I get caught back into my old negative beliefs, old stories of being the inner critic, judging self, or then turning around and judging others. So a check and change. Within that, I weave in some form of physical exercise, and I believe in doing things that are fun. So it may be a walk on the heath, it may be doing some physical yoga practice or movement to music. It's whatever makes the heart sing is essential. So I weave some of that during the day. Mindfulness with nature, I treasure and appreciate. So gratitude, having gratitude for nature, stopping for a moment and watching a robin. I could wax and wane, you know what I mean. Appreciate blossom that's falling like snow with a breeze. So rather than seeing, oh, it's cold and windy, it's wet, it's, can I see the beauty of each moment? And diet, key, so practicing non-violence on every level, so I choose not to eat anything that's caused harm to any animal, and eaten with that higher consciousness and mindfulness and in the preparation of it, and then choosing to be present in each moment, which is an ongoing come back into the flow rather than get caught by side scenes of old stories or what's happening in life, and readjusting, recalibrating, so I can show up and be present with another in the now rather than caught in the past story of own or the other's past story. So in a nutshell, and to have enjoy and appreciate life in each moment.
Okay. I'd like to ask Pavan how you use your yoga power and this Raja Yoga spiritual knowledge to support your clients, your patients, or the people in your life generally, in essence. Time is short.
Masana's just gave a lovely list of the daily practice that we practice at the centre as a yogi, and we follow that as closely as we can. But in a professional capacity, I find it very important for myself, amongst all these practices, very important to find that time in between my appointments and patients where I have some time in silence for myself. It could just be 30 seconds, it could just be a minute of pause. Because you know how it is during the day, once you start, you put your foot on the gas, that's it stays there pretty much all day long till you get to bed. So you do need to have this moment of pause, whether it's in between patients, lunchtime, wherever it is. If you find it difficult to get out of your environment or situation, even making an excuse just to go and walk to the water machine to get a cup of water to drink, that silent walk, or, if you're going to have a cough or whatever it is, just any excuse just to create space. So don't sacrifice that moment that you need, and that really helps me in between patients. I'll say, give me an extra minute, I've just got to write my notes up. But before I start writing my notes, I'll just take a couple of deep breaths, get into silence, recenter myself, and then go again. So it's always reconnecting. So that's me personally to keep me going through the day. But working with patients with their anxieties is like what Masana said right at the end about the respect we have for each other. Seeing each other, for me, the trick is trying to see each other in their best form, in their highest capacity. So no matter if somebody comes in who hasn't slept well, with toothache, who's angry, who's rude to the staff, rude to the receptionist because they just haven't slept well, and automatically you come across that patient or that person on the street, you react in the same way. You know, don't give them the time of day and maybe give manga back. But it's learning this empathy to see somebody, not judging their story beforehand, and every person that comes in front of me, give them that respect that, you know, you're an equal, you know, you're a spiritual being that has all the qualities that Masana touched upon. And when we interact at that level with anybody in front of us, it goes well. You know, that really helps a lot. So I think for me, on a daily working basis with my patients and my friends and family, is to have the highest vision of the person in front of you. Try to see things from their shoes, from their eyes. And the vibration that was spoken about earlier does reach them through the atmosphere, and they understand there's a comfortable, accepting, trusting environment, which again makes that interaction with that patient in front of me, with a person or a friend, go again smoothly. So it's allowing that space, engendering that trust, and then it goes well.
And someone wants to know, what are the key factors to spiritual health and well-being?
For spiritual well-being, I think sometimes people find it difficult to get into this whole journey of spirituality and connect with themselves. And one of the things I find is a quick cheat is just to be kind, just to be nice, just to be good to somebody else. Because by just doing a kind act, you're just doing something that we have to do. Just pass a glass of water with love and kindness. Just help someone with their shopping. Just help a pram up the stairs. Just do a kind act. And that kindness that you give out comes back immediately. So that's a real simple, cheat way of getting into a more spiritual frame of thinking. Just do good to others without any expectation. A lot of the things that we've been sharing about self-help and tips have been shared already about connecting to ourselves and spending that time. So I think for me, a quick thing is just to be kind to others, and that kindness to yourself as well, it'll come back.
And if I can add one thing, that it's that feel-good factor, it's a win-win situation, because when I am kind to someone else, they appreciate it often, maybe not always, and then the endorphins start flowing. Yeah? So those chemicals, we've got natural chemicals that we generate within our body whenever in that place of, so it's a win-win.
And perhaps maybe just to finish off, for this part of the day, earlier this week our director arrived from India, who's 102 years old, and from what I understand, she's been on the deathbed many times, and she keeps on surprising us and coming back again and again. And I think on the day that she arrived, actually, she said one thing which immediately connected me to this program. She said, happiness is the best medicine and worry is the worst disease. So I think that sums it up nicely. And thank you all for sharing, and thank you all.